Hello everyone, welcome again to another exciting episode of Let's Share. Today we'll be discussing critical issues and they link very well, but a lot of people do not know that. We'll be touching on WASH IPC and the reproductive health services. How do these two link? What's the holistic idea between them and what is it all about? Today we have with us Cabral Bintu to help us digest the topic. He is the acting health director for Kasina Nankana Municipal. Welcome, director.
Thank you very much, Molly.
It's going to be an interesting discussion. Okay. First of all, to a layman, what is WASH?
Okay, thank you. WASH stands for Water, Sanitation and Hygiene. In the health perspective, it means that the health facility should have water supplied to all service delivery points. The facility, in terms of sanitation, should have toilets to be able to meet the needs of staff and clients, which are separated for both male and female. And they should also be very sensitive for people with different abilities. And then for the hygiene component, there should be hand washing areas where there should be the provision of soap and other hand cleaning materials for clients and staff to be able to have access to all these.
So is the WASH related just to the health sector?
Not really, but I am just linking it up to the health sector. Okay. But in all other dispensations, this is the standard that should be provided in all these places.
And the IPC aspect?
Yeah, so IPC also stands for Infection Prevention and Control. And these are evidence-based strategies that have been tried and tested globally. And they are aimed at ensuring that we are reducing the rate of infections or people getting ill as a result of infections or dying as a result of infections. But then infection prevention and control is in two dimensions. One is the preventive aspect, where we will have to give education to the people. We must let them use other standard protocols like washing of the hands, wearing of the nose masks to ensure that they are not contracting infections. Then beyond that, those who still would contract the infections will need other control mechanisms where they may be hospitalized to ensure that they are given other standard treatments to ensure that we are reducing the burden of infections.
Okay. So you mentioned how to prevent the infection. How do you control? You mentioned some of the ways you prevent the infection. How do you control the infections?
Okay, so in the control mechanism, we have where patients are hospitalized and then they are given medications to ensure that they are reducing the infections that have been contracted. Okay,
so in the WASH, IPC, and reproductive health services, how do they work together in a facility?
Okay, thank you. WASH and IPC need each other to thrive, but WASH is the environment with which infection prevention must thrive. But then again, in your quest to practicing infection prevention, it also gingers you and triggers you to be able to create an enabling environment. Because if you need to really wash your hands and then people must drink safe water in the healthcare facility as a measure in infection prevention and control, then you must provide that clean water. You must ensure that there is soap at every hand washing point. You must make sure that there is tissue and then there are towels, hand washing towels at every hand washing point for clients and staff to be able to use.
So that makes the environment
very healthy.
Very healthy. So if you visit a health facility and these aren't available, then there's something happening.
There is a gap we need to address.
Okay. So how does this WASH IPC work with reproductive health services? How do they work together?
So globally, we are losing many lives from our adolescents and then our women who go to deliver in our healthcare facilities. The last assessment that was done by the WHO, we are losing up to about 1 million mothers and children globally as a result of poor infection practices. That tells us that every healthcare facility must put in place this very welcoming environment with the provision of water, toilets separated for both men and women, waste management strategies in place to ensure that we are reducing these deaths. I know because we are mentioning figures sometimes, it doesn't click on us well, but if we are losing somebody as a result of these infections that we are talking about, then we can feel it properly to talk more, because one is a number, and we are talking about 1 million mothers and children. That is so chunk.
So as the acting health director of a district, sorry, a municipal, am I right? What are some of the challenges that have existed in integrating WASH IPC and reproductive health services?
Collectively, I think national policies are fragmented. You can't find a policy that is really directed towards just WASH and reproductive health. The policies on WASH are fragmented in several other programs that are being run under the Ghana Health Service. So it will take a consolidated effort from all of us to advocate to see how best we are going to ensure that this fragmentation is well consolidated so that we can roll out these things properly. Again, if you look at the nature...
Let me come in before you continue. What do you mean by the policies are in various documents? Can you throw a little light on that?
Yeah, so you can see that you have WASH as a strategy or as a policy on its own. You won't see WASH and reproductive health as a complete policy coming out for us to be able to ensure that there's synchronization in these activities. I think this is what I am talking about. Again, if you look at the nature of our infrastructure as a service, you realize that some CHIPS facilities and health centers are constructed and you don't have adolescent health corners, you don't have toilets for even the staff who are working in those facilities. It will surprise you to visit some districts only to realize that even in the whole district, there's no incinerator where waste is being generated from several healthcare facilities within this dispensation. Again, another challenge has to do with data. We all must plan and do things based on data. But one of the very serious gaps or challenges we see within the health system, and where I find myself, is that we are all not very cognizant of WASH data for planning purposes. And I think these are issues that when we try to address, we should be able to reduce our infections.
If you're an adolescent out there and you need any information on your sexual reproductive health, do not hesitate to contact She Plus hotline on 0800 001 122 or any of the numbers on your screen. Thank you. What are some of the successful interventions that has been noticed after integrating WASH IPC and reproductive health services?
Okay, I know the CHIPS concept is one of the serious initiatives that has come to really support. The CHIPS concept talks about the community-based health planning services, where you are planning health services with the community where the location of the CHIPS facility is. And it has encouraged more people to support in ensuring that the infrastructure that is given to them, at least they are now dotting these WASH facilities in these CHIPS facilities to help the people within. Again, in the Upper East region, I can count of the Mother Baby Friendly Health Initiative project, which came to ensure that infrastructure was beefed up in a number of health centers within the region. I can also confidently talk about the WASH for Public Health initiative that was also carried out by WaterAid Ghana in some selected districts, where we saw an upgrade in infrastructure for toilets that were of standard, providing the menstrual hygiene corners where our adolescents can easily change and then refresh themselves and then have their waste well disposed of. Again, I can talk about our adolescent youth clubs that we are forming now, that they are becoming more conscious and supporting whatever activities that we are doing at the community level.
Okay, so how can improving WASH IPC in healthcare facilities support or enhance reproductive health outcomes or services?
Definitely, once our adolescents and our women are not falling sick, they will have a quota to contribute to the development of that community itself and then to the national as a whole. No community wants or no family wants to see a member being burdened or infected by a disease. And this sometimes even leads to unnecessary deaths. And I don't think these are the things that we want to see coming from healthcare facilities.
Yeah, that's true. We do not want to see more deaths. So, how does the SHARE project play a link in WASH IPC and reproductive health?
For me, I have said that the SHARE project is one of the very innovative and good projects that I have witnessed ever be in the system, where you have a whole consortium of partners coming together, and everybody has a key role that is playing, and they are interlinked and ensuring that we are achieving the desired goal. I will start by saying that as part of the objectives of the project, one of the key deliverables they have done is to build the capacities of health staff across selected facilities within the districts. And then their capacities have been built to ensure that they are enhancing the reduction in infections by being very cognizant of the WASH situation and how to properly position themselves to implement infection prevention and control mechanisms or activities. So that's one. It has even extended to training of volunteers, where volunteers or orderlies who are being given some special training to be able to support service delivery at the health care level. Again,
Director, sorry, who are orderlies? What are orderlies, or who are orderlies?
so these are the group of staff we have within our healthcare premises who do the cleaning, the sweeping, and one of the things we don't all take serious note is that we feel that we don't know they are the people who should be given proper treatment and training, because in all our offices there are those doing the cleaning, but we don't sometimes care about what they use in cleaning, whether we are providing them with utility gloves, we are providing them with all the disinfectants and soaps, and this is a very critical area I think the SHARE project is into. Again, beyond just that, the SHARE project has also built the capacities of all facilities within the catchment area to ensure that they are using a tool called the WashFit tool. This is a tool that is globally accepted to be able to assess the minimum standard of WASH in healthcare facilities. And the aim is to be able to reduce the burden of infections with us. So this is a tool that is being used by healthcare facilities on a quarterly basis to be able to measure themselves in the area of WASH and infection prevention. And doable action plans are drawn. So this links up to my earlier point by saying that there is the need to be able to budget and ensure that we are implementing the doable plans. I know as we go on, we would finally get to some impact studies where we will get to know what has really transpired over these years after the implementation and the use of that tool in the system.
Okay, Cabral, can you give us more highlights on how these WASH IPC and reproductive health connects very well? A detailed example would do.
Okay, so I think before the implementation of the SHARE project within the municipality, there was a conscious effort to be able to identify we have adolescent-friendly corners in the healthcare facilities. And I know one of the key interventions that will be coming from the SHARE project is to see how we can refurbish or rehabilitate these corners to ensure youth friendliness. In recent monitorings that were supported by the SHARE project, it was realized that our health staff do really have the capacity to be able to provide these services, but our clients, our adolescents, do not want to come because they do not have any friendly corners to be able to have access to the services that they will wish for. So it will be very proper that we put these things in place. In some facilities, they have decided to designate certain areas. And we know for adolescents, mostly they won't like to come at normal times where every other person is there, because we are still in the quest of getting the rights for them. So most of them want to visit in the evenings at the healthcare facilities for every other service that they will need, apart from emergency situations. So allocating those areas and ensuring that we are beginning to psych the people up to know that they have what it takes to come for such services is very important.
So, Cabral, it has been an interesting discussion, but I would want to ask you a personal question, and it should go to every director out there. What are your plans of sustaining all these interventions that are coming to your various municipalities or districts after the project ends?
Thank you, Molly. For me, this programs and projects that are coming on board are not for the SHARE project. They are for us. So we first of all must have that sense of ownership to take up whatever has been started with them. Again, I don't see whatever the SHARE project is bringing on board as a vertical program. We are incorporating it into already existing routine programs to ensure that when funding is over, these things are routinized for us to be able to ensure it. I give an example that the SHARE project selected only 20 facilities within my municipality for the capacity building activities and to roll out the WashFit tool for them to be able to have their doable action plans. But I have taken an initiative with my management and that of the War Memorial Hospital in Navrongo to say that with our internally generated funds, can't we extend this training to all other structured facilities that are within our catchment area? And this is something that we are giving an invitation to the SHARE management and to the country director of WaterAid Ghana to also join, because it is a way to tell them that after what they have done for us, we can continue and extend it. So these are some few things that we feel. And I feel that we must also be conscious about budgeting and spending in the area of WASH. WASH is highly demanding in terms of finances. And if we are not very conscious, one other implementation guideline I have put in place is that once things come in the direction of WASH, those memos will have to definitely be given priority. And that is what I guess if we all put in place may ensure that we are getting the deliverables in sustaining whatever gains we are going to get from the SHARE project.
Is the healthcare facility in your area WASH friendly? Leave your answers in the comment section. We've come to the end of yet another exciting episode of Let's Share. Thank you very much, Cabral. It's been fun having him here. We've been able to link the importance of WASH IPC to reproductive health services. Next week, we'll be diving into a very interesting yet questionable area that a lot of people do not want to talk about: teenage pregnancy. Do you want to know what's on everyone's mind or the adolescent's mind? Don't forget, tune in and let's discuss teenage pregnancy. It's been Let's Share. Take care. Bye.